the more it rises. So that's how a ship doesn't sink, okay? That's really amazing though, if you think about it. How do they not see that? Goodness gracious. So benefits of buoyancy. Decreasing the effects of gravity. It's a tremendous advantage to take somebody who has severe osteoarthritis, even rheumatoid arthritis, obese, all these folks that have really problems with gravity influencing their joints. Putting them in the water is a tremendous, tremendous advantage. It obviously decreases weight bearing. So if you've got somebody on a weight bearing restriction, which happens a great deal, actually not that much anymore, but it used to happen a lot. Somebody would say, oh, I've had this knee surgery, blah, blah, blah. I'm gonna be at 50% weight bearing. Well, then you put them in the water up to their waist, and that's about 50% right there. And they can do everything in the water that they can do on dry land at that point. Obviously gonna reduce the joint compressive forces. Again, they don't have to exert as much effort. It makes the handling of the patient much easier. They're able to do more, and there's really no risk of falling in the water. They're not gonna hit the bottom of the pool or anything like that. Issues, impairing balance of the therapist. Difficult sometimes to position yourself, and you'll see the therapist that you're gonna see, gosh, Mandy weighs what, 95 pounds probably?
Yeah, she's like a ring.
She's tiny. But she can maneuver these people that are very, very, very big. It can be difficult to stabilize just because of the buoyancy of the water. Flaccid lower extremities may have float. I've never experienced that, but certainly could be. And not as much proprioceptive input from that. The benefits outweigh the issues for sure. Buoyancy assisted, allowing a limb to passively move through the water, again, helps get them moving, versus buoyancy supported. Limb is parallel to the water surface, so a lot of times I'll have their arms out like this, as opposed to buoyancy resisted, so the limbs moves down from a horizontal position. So if they have to push down, that's obviously going to give them resistance. If they've got paddles in their hands or the floaty things, that's going to even be even more resistance. You'll see all of those on Wednesday. Again, waist level, we'll get to about 50%. Chest level is 20% weight bearing. Neck level, or toe touch weight bearing at about 10%. Okay. And again, this used to be a big deal when there were more weight bearing restrictions on total hips and things like that. Not so much anymore. Hydrostatic pressure. So the pressure of the water has benefits as well. It helps to decrease swelling, offsets tendency for blood pooling, assists with inspiration and exhalation. Problems, chest pressure. We've all been in the water before up to here, and you feel that just added pressure there. Some people have trouble with that. Some people can't breathe through that. If they have decreased vital capacity, you're going to have to factor that in for sure. Viscosity is the friction, the thickness of the water. Benefits can provide resistance to movement. So if you take somebody's arm and have them go through the water like this, the friction that is developed along with the actual resistance makes the pec work more, or makes the scapular retractors work more, okay? Resistance increases with the speed of movement. So if the harder you go, the faster you go, the more resistance you can get. So you can factor that into your program as well. Resistance is 0 when the effort stops. We allow increase of time. You can take extra weight out of the pool with you for sure. That's a tough thing sometimes. Turbulence is what we're going to talk about here when we're moving quickly through the water. You can increase strength and resistance that way. You can use it to move the body. treat the tactile defensiveness, help stability and balance issues, dampens the involuntary movement. But again, how do you create this? You increase the surface area, hand paddles, the little hand weight looking like things, change directions on quick reversals, will increase the turbulence. You can have equipment. So where I was at in Virginia, we had what was known as a SwimX. Anybody seen the SwimX or a HydroWorks before? It's a huge, so the pool is about the size of Ann's office, okay? And on one end of that is a huge turbine. And it creates a current, just like a treadmill, underwater treadmill, if you will. So the patient is working against whatever you set it at. And you can set it to 1 mile an hour to like 4 or 5 miles an hour, which is a heavy current. So someone can be swimming as fast as they go and they're not going anywhere. Okay? So that's a tremendous, I mean, it's amazing what you can do in that. You can have them hold on the side, and that turbine pushing against them acts as a traction force for their whole body. You get somebody with just tremendous low back pain, you put them there and they just hold on against the side and their body just, turbine kicks in, just stretches everything out. They feel great. The water feels great as well. That's an amazing, amazing piece of equipment. I'll see if I can get a picture of that. Relative density. So we said earlier, weight of the object to the weight of the equal volume of water, the displacement, that Archimedes principle. All right, so if you've got somebody who's had a stroke and half of their body is not working, okay, or is spastic, has a lot of tone and so forth, they will roll towards that side, okay? If they're swollen, it will roll to the opposite side, right? So if you put them on one side, that's what will come up. If you have somebody who is a amputee, what's gonna happen? You got less mass on one side, right? So that side's gonna float compared to the other side. So you gotta think about some of those things. Sometimes you'll wanna strap something to their residual limb or what have you. I was really fortunate to work in that setting. We had a PTA who she spent her entire day in the water. We would bring our folks in, and if they were good candidates for the pool, she would take them, do the whole exercise program over there. It was fantastic. Obviously, we got some light considerations here. Not a big deal. Wear some sunglasses if you're outside. You can break up the spasm pain cycle. And again, you've got all kinds of folks with comorbidity. You see people who have chronic pain, depression, all these things. I've seen the water do amazing, amazing things. Now, who do you not put in the water? Okay? You don't want to put people in there that are scared of the water. Okay? Or if they say, I don't swim, but you're going to put them in a level that's 3 or 4 feet deep, you got to be careful. You can't leave them alone for any reason, way, shape, or form. All the hip precautions, back, any kind of open wounds, can't do that. Posture, we want to keep them in a neutral spine if we can do that. Again, there's no magic to aquatic therapy. Just get them moving. You'll see Mandy will do a great job of taking whatever this person can or can't do and applying that under the water. And you'll see somebody that looks like, you'll see them walk in and it'll be a huge limp or neglect on one side, and they get in the water and they look like a totally different person. It's great to see. Pool temperature should be no greater than 90 degrees. Why is that? So for the arthritic patients, we certainly don't want it cold, right? That's not gonna feel good to them. It just promote more stiffness and so forth. So again, around 90 to try to keep things, I wanna say Sportsplex keeps it just short of 90, something like that. But then they've got the lap pool, so they try to modulate that a little bit too, because you don't wanna be swimming laps in a 90-degree pool. We'll ask her what the temp is. What's another population that would do poorly with a higher temperature? No, most of the old people like the warm. Yeah, feels better on the joints.
Burn patients?
Burn patients.
Bariatric.
I don't know that you're gonna put them in. MS population, you cannot put them in to really warm water.
Remember, MS is the demyelination of the nerves, so heat is gonna increase those impulses. So if there's no myelination there, those impulses aren't gonna be firing as much.
So all of these she'll demonstrate, or she'll have the patients demonstrate. You got range of motion exercises, you get strengthening exercises, balance coordination, endurance exercises, more specific types of things. If they're having trouble, you know, we talked about tandem walking when we were doing the bird balance assessment before. You can do all of these things in the water that are pretty demanding. The flutter kicks, deep water cycling and running, all those are very demanding there. And then just traditional exercises. My mom goes to a exercise class for arthritic patients, and they meet in the pool. I think they do two days a week, and then 1 day a week on land. She loves it. She'd rather do that than anything. Again, this is just a basic plan here. She'll go over this with you. You gotta warm up, you gotta stretch, you gotta exercises, some resistance, and then a cool down. And again, make sure you keep things individualized if this is something that you see or do. Does Josh still do some aquatics?
Every Wednesday.
Every Wednesday. Does he enjoy it?
Yeah.
Yep.
'Cause I think it's
I don't know
funny.
people that don't, to be honest with you. I think everybody enjoys it.
He likes the different pace from
Yeah.
being in the clinic.
No doubt. Well, and you can treat 3,
has
4,
like-
5 people at a time too, pretty easily, if they're not completely hands-on. That's that. Mandy does a great job. The only problem there is it's very difficult to hear. The pool, there's people running around and all that stuff. It's really hard to hear. So get as close as you can to her, and just keep your voices down. Don't talk while we're in there because you won't be able to hear anything.
Do you want clinical shirts on Wednesday?
We'll be good. All right, so we didn't get to any spine. We're already behind. Such is life. Are we clear on Wednesday?
Wednesday, you are
Yeah.
wearing business casual though. Yeah, not this attire.
We
What
good?
is the schedule Wednesday? We're coming here first or no?
We're not coming here first. We're going to Opelika.
Y'all chill out, I was not here.
Opelika, 8 a.m. We're there for an hour and 45 minutes. We've got their lab, nursing lab.
9 to 10 to 45.
Are you going to structure that so I'll know what
I
to do?
will, yes.
Okay, good.
So what we're gonna be doing there, we're gonna have the hospital bed, so we're gonna be practicing, the bed mobility stuff that Ms. Jordan went over last week, as well as at the same time, I will bring those gate belts with us. Kind of get you familiar with what the hospital beds look like and how they, function, so buttons, how to put up rails, alarms, and all that stuff.
Then we'll go to Sportsplex for probably an hour. You can get some lunch. lunch, and we'll meet you back here. We'll have a quiz at 1. Then we will, gotta do something fun at that point. And then we'll, if we have time, we'll do the goniometry. I don't know if we'll have time.
We'll see.
We'll probably
But I
just
do
we'll probably
recommend-
just do spine.
If we don't, you need to go over all your goni stuff before you go into clinic on Friday. Last thing you want is for them to say, hey, do you know how to measure a shoulder? And you blank. Okay, so make
Or
sure.
an ankle, for all you people who can't measure dorsiflexion. Oh, embarrassing.
Tomorrow you have transfer